Hi, I'm Ed Jacobs, founder of Impact Therapy, which is an active, multisensory, creative, theory-driven approach to counseling. And I'm here with Heidi O'Toole, who does addictions workshops. And we did a previous clip on YouTube showing how impact therapy and stages of change goes together. So this is a follow-up where, Heidi, I think you're going to...
I'm going to show how the 12 steps integrate into the stages of change model. Both of them are models for change. One, stages of change helps us assess where clients are in the initial phase of treatment and then ongoing. And then, of course, the 12 steps is the recovery model that works best for most.
Do you want me to play a client, or you want to just talk about it?
I think I'll just show how the 12 steps are a great adjunct for the stages of change, okay? So we know the different stages of change. We have them here, the 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance, okay? Those are the stages, again, that we use to assess where a client is, and we check their progress throughout their treatment. Very early on in treatment, we recommend people go to meetings, 12-step meetings. And so here are where the 12 steps fit into this model. Pre-contemplation is just when you're just not thinking. You're more in an emotional state. It's what we call denial in the addictions field. You haven't yet connected the dots to your drinking, your drugging, and your consequences. So those stages, in pre-contemplation, not being aware, and then contemplating, and then working on preparing to be able to do something different. Those are steps 1 through 3. So the first 3 stages of change cover the first 3 of the 12 steps.
And these weren't developed together.
They were not developed together. No, actually the 12 steps were developed in 1939. The stages of change model was developed in the mid-80s. Okay? So first 3 steps really, and I like the visual because it shows we're just here on a flat but yet progressive line. We haven't really gone to a different level of life. We are just progressing. We're starting to move. And the first 3 steps, there's not a lot of action in the first 3 steps. It's really just about getting sober and then how it is you're going to stay sober. So the third step leads into then what we call the action steps. And those are steps 4 through 9. So here is the action stage of change, and then 4, 5, 6, 7, 8, 9. These are the inventory and amends steps. Many people are familiar with people do their inventory. And you do that with the sponsor, and as addictions counselors, we can support that inventory process. So the inventory process, 4 and 5, 6 and 7 is taking a look at what you uncovered in your inventory, and then 8 and 9 is going and making amends for the adversity that you caused in other people's lives. That's a lot of work. That's a lot of action. And if you notice, you are now at a different level of life. It increases your life level when you take action. That leads us into the maintenance phase of change, and also it is sometimes called the maintenance phase of recovery, which are steps 10, 11, and 12. These 3 steps is where there's growth and expansion. And in maintenance, you're now living in a different life level. You're maintaining a sober lifestyle. And so you continue to grow in understanding on how the 12 steps can be an integral part of your life. It's a design for living a way of life versus the addiction down here.
That's great. Actually, that's the first time I've ever seen you do that.
Okay.
I like it.
Yeah. And it really, what we do is we get, we get into our client's world, and so certainly we don't have to become addicted to get into their world, but our job is to be able to relate what it is we do to their direct life experience.
So the use of impact therapy, stages of change, and the 12 steps, I think all addictions counselors...
If you use this approach, if you frame up the impact therapy approach with these 2 models, it has been the most efficient use of intervention that I have seen in 20 plus years.
Yeah, because you were doing counseling without the multi-sensory stuff originally, I think.
Yes.
And this is just makes it...
Oh, well, it's not even improving what it was you can do. To me, it's an apples and oranges. Yeah. You're now you're taking counseling or being helpful to another level.
Yeah. For more information about impact therapy, go to impacttherapy.com. And if you want to get a hold of Heidi, you can get in touch with her if you'll contact me, and certainly I'll forward it to Heidi.